Hi, welcome to our Lipedema MD website, and this is a web page dedicated specifically for liposuction for lipedema. As you know, lipedema affects approximately 11% of people. I'm not going to go into the details of the disease. There are plenty of information on this website and the others. I wanted to focus on liposuction itself. So, the liposuction has been a staple of plastic surgery treatment for the last 30 some years, if not more. But liposuction for lipedema is a little different. I know that on some of the forums, people mention that liposuction is the same regardless where it's done and for what reason it's done. But I really disagree, especially after doing hundreds and hundreds of lipedema surgeries. I can tell you it is different. And let me explain to you why. When we deal with cosmetic patients, usually we remove small areas of isolated fat from 1, 2, 3, 4, 5 areas, but not all over the place. Our goal is to shape the body and create more appealing physical shape or contour. So we go to those very specific areas and we do liposuction. We do liposuction just in those specific areas with understanding that we're trying to get the contour. That's all we're doing. In lipedema, our philosophy is completely different. At least my philosophy is different. Lipedema patients, with the same approach as the cosmetic patients, what will happen is that as the disease progresses, you are going to have recurrence of the disease in the areas which were not treated. If you look at lipedema is a disease of abnormal lymphatic vessels. You have increased elasticity of the tissues, so your lower extremities and lower half of the body or the arms do not propagate the lymph appropriately. When the muscle contracts, it pushes on lymphatic vessels, and lymphatic vessels are supposed to push the lymph up the stream and eventually get into the left subclavian vessel. The problem is, in a lot of patients, those elastic tissues that's supposed to promote this type of mechanism do not work because they're overly stretching. So as the muscles compress and they push on lymphatic vessels, the back wall, so to speak, of a subcutaneous fascia or skin is really not resisting. They're just moving along with it. So the lymphatic system doesn't work. The way I look at liposuction is that we're not just removing the painful fat. We are creating a circumferential internal stocking, so to speak, that does not stretch as much. That scar tissue that most people don't want, we try to create with the purpose of creating additional stiffness or structure inside of the leg that promotes more normal function of the lymphatics. I don't think that removing the painful fat by itself really solves the problem in the long term. So when we're treating the patients with lymphedema, we don't just treat 1, 2, or 3 areas. We have to treat the whole leg circumferentially. Okay, even if you have a mild disease at this point, you have to treat all around the leg, the front and the back, from the ankle all the way up to the hip. Even if the lower leg is not fully affected in the disease right now, it's possible the disease can return at the point of menopause, and that's again the reason to do it circumferentially. So one of the differences between cosmetic and reconstructive is that reconstructive creates circumferential scar tissue. And that's why I believe it's important to go to a plastic surgeon or lipedema specialist who understands what the final goal is. I have seen the patients over the years who had limited liposuction for lipedema. For example, it was done on the inner knees or outer thighs or some other areas. And as the menopause comes back, the other areas blow up. So that's the key. Now, the lipedema usually can be treated in a limited fashion, so you take one area at a time, or you can treat multiple areas at the same time. We have state and federal regulations that officially limit our ability to remove large amounts of fat in an outpatient setting. Even though the studies are somewhat questionable, the reality is that there are laws that prevent us from doing it. For example, in the state of New Jersey where I'm at, we're not allowed to remove more than 5 liters of fat on an outpatient basis. The patient has to stay overnight to be safe. And I really think it's important. I agree with that completely. So the doctors who have the ability to do the surgery in a hospital or extended stay facility usually can remove more than the people who operate in their own in-office surgery centers or just procedure rooms. I think for the patients who are going through lipedema surgery, it's important to understand that the safety should be of paramount concern, not convenience of the doctor or reimbursement of the insurance company. Remember, your life is more important than that. So when you're considering who is going to do your surgery, just look at the experience, look at where things are done. Does the facility look clean? Is it accredited? Does it have safety measures? All of it has to come as a part of overall decision to have the surgery, okay? So there are two groups, again, of doctors. Some of them do smaller portions like the lower legs first, and then the thighs, and then the outer thighs. And they do it because they're limited in the amount of fat that they can remove at the same time. And that's why those doctors do 5, 6, 7, 8, 9 surgeries, and they can do it on a monthly basis. So you do the lower legs first, then you do the front thighs second, and so on and so forth. Those surgeries take less time. They can be done on an outpatient basis. Individually, they're less expensive, but cumulatively, they can be more expensive to both the patient and insurance company, okay? Now, then there are people who do larger surgeries like myself, where I would do the liposuction all the way from the ankle, all the way up to the hip and then some. We treat both legs at the same time, and we treat the front, inside, and outside on both sides at the same time. I do not treat the back of the legs at the same time, especially in lipedema patients, because I do not want to have complications, and I want to have a safe area where you have normal lymphatics. But 3 months later, people in our practice will come back, we flip them over, and we do the back of the legs from the ankle all the way up to the hip, outsides and insides. So insides and outsides get treated twice, okay? And that's the way at least we do it. Now, if there are patients who have medical issues, if there are patients who want less aggressive surgery, then we can do a smaller surgery like the other doctors do who focus on solely outpatient practice. So the selection of whether you do it as a larger surgery in a hospital where we remove 8 to 15 liters, or when we do smaller surgery when we take up to 5 liters, it's completely up to you. You have to look at your health, at availability of time, and a desired number of surgeries, and basically how these approaches fit in your overall lifestyle. So that's it, kind of two approaches. When you look at the facility, and it's important to say that safety of the facility is also important. So you want to make sure that's done either in a hospital or accredited surgery center. There are several accrediting bodies. They provide certain basic safety guidelines. Okay, don't do it in an outpatient room, somewhere in the back room. Make sure the doctor follows safety protocols, that they have emergency equipment just in case. So all of that has to come in play when you select your surgeon.